Back in the day, it was the classic conversation. Where do you want to eat? I don't know. Where do you want to eat? I don't know. Where do you want to eat? You'd finally pick up the phone, sit on hold forever, and then find out there were no tables.
I'm sorry.
Or that the place wasn't even open. And while much change has recently come to the restaurant industry, it's been many years now that you can both decide on and book a restaurant right from your phone, as well as leverage technology to see nearby options, view ratings, and even earn points towards a future meal. So it's no surprise that last year, 54% of restaurant guests said that online reservation tools were an extremely important factor in deciding where to dine, and 40% of restaurateurs agreed. These days, a restaurant doesn't even have to be on the clock to get a booking. The system works even when the doors are locked and the chairs are on the tables. If only your healthcare provider made things that easy. Unfortunately, patients are still accessing health service options offline, mostly via the phone. It was a big problem before COVID-19, and hospitals are now realizing where they're falling short. Last year, patient calls were transferred nearly 63% of the time, and only 50% could leave those calls with an actual appointment booked. That's frustrating. Certainly not the goal. And even if they did book but needed to make adjustments later, they didn't necessarily call in those changes. Missed appointments cost the U.S. healthcare system more than $150 billion last year. Last year, 77% of patients said the ability to book, change, or cancel appointments online was important.
Can I do that?
Yet, only 40% of large health systems allowed them to do that.
We don't do that.
60% even said they looked for an alternate provider in search of a sooner appointment.
We'll go somewhere else.
Today, the demand for these services has only grown as a result of COVID. That gap is precisely what Providence's Digital Innovation Group is working on. Before, during the height of, and now while managing the COVID crisis, they're pushing to bring a better experience to healthcare. One that allows patients to see availability real-time at specific locations, then book directly. No more holding on the phone. Also make appointments during off hours, change or cancel them easily, and using Providence Health Connect, book through Amazon Alexa. A study earlier this year, last year, indicated that when a customer booked an appointment online and received a confirmation message via text or email, the no-show rate dropped by 50%. A system like that would go a long way toward reassuring patients in unsettling times, as well as helping recoup half of that $150 billion lost each year when they don't come in. If healthcare can bring significantly more of its scheduling into the digital space, it'll not only help reassure people during crises and save the industry hundreds of billions, it'll make it easier to deliver quality care. And at our Digital Innovation Group, we can't wait to make that happen. Learn more about Providence's Digital Innovation Group at www.providence-dig.org.